Evaluation is a preliminary assessment tool of swallowing status for the patient suspected of having dysphagia. The clinical swallow evaluation is used to define the potential cause along with a medical history. As well, it will help establish a working hypothesis to define the disorder and assist in establishing a tentative therapy plan. Through this assessment, a further list of questions may also be developed that would need to be answered using other assessment tools. This evaluation also will create an understanding of the patient's readiness for further testing and determine further assessment tools to be used in the clinical swallow evaluation. The following steps should be covered. The case history should cover the following: the patient's chief complaint, what the current nutritional means is, whether NPO or oral, when did the difficulty begin and how did it progress, have there been recent hospitalizations or pneumonia, present or past illnesses, surgeries, or trauma, have they ever had prior medical management of their dysphagia, are they currently on any medications, what is their current cognitive state, is their weight stable or fluctuating? What are the average length of meal times for this patient? What is their social history, habits, and how will dysphagia affect these? Do they have any of the associated symptoms of dysphagia like voice change, coughing, throat clearing, dehydration, weight loss, or weakness of the tongue, lips, limbs, etc.?
I'm the speech language pathologist that will be conducting your bedside swallow today, and we're just going to do a quick case history before we get started.
Okay.
So what is your biggest complaint with your swallowing?
I just basically have been coughing a lot.
Okay.
On basically everything. So.
Okay.
And I have a lot of chest pain.
Chest pain.
Yeah, a lot of chest pain.
Okay, so solids are hard for you. To
solid
swallow?
foods, yeah.
Okay. And liquids, how are they?
They didn't used to be bad, but now they're bad.
Okay, so they've progressed.
Yeah.
And how about taking your medications?
I only take. I actually don't take any prescribed medications right now.
Okay.
I was taking pantoprazole or something
For acid reflux.
Mm-hmm.
Okay.
But now it got a lot better, so I'm just taking Tums now.
Okay.
So
Okay.
that's been working.
So, but for your swallowing, you don't notice any troubles when you are taking pills?
It has gotten harder for me to take my pills. Yeah.
Harder to take your medication. And when did this start, your swallowing problems?
About a month and a half ago.
Okay. And do you have any recent pneumonia that you know of?
Besides this time,
Yeah.
no. No.
So no recent hospitalizations for pneumonia besides what you're currently here for?
Right.
Okay. And how about some associated symptoms with your swallowing disorder? Any notice of voice change, weakness of your tongue or lips, coughing, you said, throat clearing, anything else?
Mm-hmm. Yeah, just a lot of coughing, a lot of chest pain. I just feel like every time I eat anything, it feels like it's just getting stuck in my throat.
Okay.
I feel like my voice is a lot groggier,
Okay.
always kind of like just rough sounding. It
Rough
never used to
sounding
be
voice.
like that.
Okay, and any extreme weight loss that you've noticed?
No.
Okay. And how about any present illnesses besides the pneumonia?
Just the acid reflux.
Okay. And no past surgery or trauma that you're aware of?
Nope.
Okay. No prior surgeries, correct? I read in your chart?
Correct.
Okay. And any medical management for the swallowing disorder? Are you currently getting
No.
any treatment?
No, I never have before.
Okay. And your weight has been stable since your swallowing
Yes.
disorder? Okay. And what is your average meal times? Do you eat 3 times a day? What is the average day look like?
Yeah, I'd say, I'm a big breakfast person.
Okay.
Always eat breakfast.
Okay.
And then, yeah, I normally eat like a late lunch and like a fairly small meal for dinner.
Okay, and has this affected you socially with your social life?
Kind of, to be
Okay.
honest, yeah.
Okay.
It's just, I don't really like eating in public anymore or like around anyone but my husband. Because
Okay.
I cough so much.
Okay, great. Thank you.
The oral mechanism exam should test the following: range of motion, strength, symmetry of coordination, the sensation in the mouth, and facial components of swallowing. As well, the following structures should be checked: the mandible, lips, tongue, velum, and teeth. Other issues that should be evaluated are facial numbness, tingling, dysphonia, dysarthria, breath support, hypernasality, whether there's a volitional cough or secretions.
Okay, Phoebe, this is my student Jessica, and she's going to do your oral mechanism exam just to check the structures of your face.
Okay. Hi, it's nice to meet you, Phoebe.
Nice to meet you.
Okay, so to start, can I just get you to open your mouth really quick, please? Lovely. Can you open and close? Thank you. Now can you pucker your lips like you're blowing a kiss? Great. Okay. Can you smile, please? Lovely. Can you puff your cheeks and hold in some air like you're blowing a bubble? Thank you.
Good.
Great. All right, can I have you stick out your tongue, please? Great. Thank you. And now can you move your tongue? You're going to push against the stick. Can you move it to the right, please? Lovely. And then to the left? Great. And I'm going to have you push your tongue tip up against the stick. Okay. And then down, please. Okay. And now I'm just going to have you do quicker movements, left to right, and then up and down, please.
Okay.
So I'm actually going to look in now at your throat a little bit more. So can I have you stick out your tongue and say ah?
Things to be looked for during these trials are the patient's feeding skills, oral skills. Can they manage and maintain an upright position? What are their respiratory needs, and how is that coordinated during PO intake? How is the swallow initiation timing and hyolaryngeal elevation excursion? And how many swallows does it take to get the bolus down? All of this information is then used to determine if the patient will be NPO or PO for their nutritional intake. As well, it will determine if there should be further testing with the MBS or fees, and what strategies should be put into place.
Okay, Phoebe, these are some ice chips. Swallow. Say ah. Okay, how do you feel? Good. This is water. Okay, swallow. Good. Say ah. Okay. Okay, here's some pudding. Take this for me. Swallow. Okay, say ah. Okay, now let me take a look in your mouth. Good? Okay. Okay, next, this is just a soft chewable, and it's just a Nutrigrain bar.
Okay.
Okay, so 2 swallows, take that down. Let me take a look inside. Good? Okay. Okay, our last one is just a hard chewable cracker. Okay, swallow. Okay. And so, some water. Yeah. Okay, good.
One of the limitations of the clinical swallow evaluation is that the clinician can only assess what is physically seen. An MBS or FEES is recommended when the clinician sees signs and symptoms of aspiration or when silent aspiration is suspected.